I'm Haley.
Hi, I'm Neem.
Hi, I'm Janine.
And I'm Elena. Our group is going to be discussing rubber tip stimulators and Stim-u-dents.
Some common brands are Gum, Oral-B, The Natural Dentist, and Gum Picks. The rubber tips were found at Shoppers Drug Mart. They were not found at the local Walmart. However, they were found online as well as the Stim-u-dents. The rubber tips on the end of a toothbrush were found on cleanteeth.com. The prices vary. For the rubber tip on the end of a toothbrush is about $5 on the Clean Teeth website, and rubber tip stimulators are about $10 in the store to purchase. However, online on Amazon, I was able to purchase the stimulator with extra rubber tips for about $20. Stim-u-dents are about $10 to $25, usually come in a pack of 4. They're like little match boxes. Gum stimulator is about $17.99 and found on Amazon. Stim-u-dents are used to remove plaque. This helps reduce your risk of gingivitis. Stimulants also remove plaque as well as stimulate the blood flow and oxygen to your gums. For active ingredients, there really isn't any, as it's just a rubber tip or the wood for the Stim-u-dents, which is a wood that doesn't splinter.
Who is the target audience? Rubber stimulators are not limited to any individual with a certain age or disease, although there are some people with conditions that will especially benefit from using the rubber tip stimulator. Author Zia Sherrill states that anyone can use gum stimulators for effortless plaque removal and keeping gums healthy. However, dental professionals generally recommend them for people with gum disease, periodontal disease, and/or implants. Stim-u-dents are also used for the prevention of gum disease and periodontia. It's important to note that Stim-u-dents will not reverse the effects of gum disease, but it will prevent the disease from getting any worse. Furthermore, both rubber tip stimulators and Stim-u-dents can be beneficial to add to your self-care routine if used properly. Too much pressure to the gums with either tool can aid in the process of recession. The pressure applied to the gums should always be light and never forced. How do you use it? After brushing and flossing, run the rubber tip stimulator under warm water to soften the edge. Then, use the stimulator at a 45-degree angle as to be in line with the tooth surface in the sulcus. Gently massage the gum line for 10 to 15 seconds for each tooth. Use the tool from proximal to proximal and use circular motion at interdental spaces. Make sure that the tool is well adapted to the tooth surface so that it doesn't pull at the gums and cause irritation or recession. For Stim-u-dents, the person using the tool should moisten the Stim-u-dent thoroughly in their mouth to soften the wood. Next, use the Stim-u-dent between the teeth with the narrow, flat side next to the gums. Then, use a gentle in and out motion to clean between the teeth. Remember not to force the Stim-u-dent into tightly spaced teeth. How is it marketed? Although there are no marketing strategies for both the Stim-u-dent and the rubber tip stimulator, there is a website that was specifically created to promote Stim-u-dents. This website includes how to use it and how it will benefit you in your daily self-care routine.
So what does research say about the rubber tip stimulator? Well, that it may reduce plaque more effectively than just toothbrushing alone in the short term, but it may not have the same effect on gingivitis. And studies have shown that the rubber stick stimulator doesn't demonstrate superiority or inferiority compared to flossing in controlling gingivitis or plaque after 3 months. Incorporating the rubber tip stimulator into my oral health routine presented an initial challenge as I struggled to angle at the recommended 45-degree angles at the gingival margin as instructed. I found it relatively easy to angle at the mandibular and the maxillary labial anteriors, mandibular buccals, and lingual. The most challenging area for me was my maxillary lingual side. So would we recommend the rubber tip stimulator? Despite the initial difficulties of adapting this tool, incorporating the rubber tip stimulator, especially at the maxillary buccals and the mandibular lingual, effectively eliminates a significant amount of debris. This is crucial as the max buckles in the manlingual or bisalivary gland, which is a common area for plaque development. As someone who is diligent about flossing, I believe that this tool could be beneficial in addressing issues of plaque development.
So our research indicates that Stim-u-dents has demonstrated efficiency in improving the interdental gingival inflammation by significantly reducing interdental gingival bleeding. However, in terms of visual plaque removal, it is not as effective as traditional flossing. According to the CDHA journal, while flossing typically remains the superior method for interdental papilla and food debris removal when combined with brushing, certain interdental aids, including Stim-u-dent, can offer advantages for individuals with specific dental conditions. For instance, those with blunted interdental papilla or wide spaces between teeth may find the triangular wooden tool more efficient in cleaning wider embrasures, adapting to these spaces better than floss. During our week-long trial, we found Stim-u-dents much easier to use than traditional floss, requiring no special technique, similar to a regular toothpick. Once moistened with saliva, it became flexible and softer, eliminating the risk of splintering. Notably, none of our team members experienced bleeding while using it. However, despite its convenience, we encountered challenges in thoroughly cleaning interdental area due to our pointed interdental papilla, particularly for molars. Stim-u-dent couldn't reach even halfway through. Consequently, after using Stim-u-dent, we still noticed food debris when we attempted to floss. Additionally, we experienced considerable pressure against our gum despite its adaptable triangle shape. We would definitely recommend Stim-u-dents to our clients and our classmates with blunted papilla or severe embrasures, especially those with disabilities, making manual flossing difficult due to requiring delicate movements. However, for individuals like us with pointed interdental papilla, we strongly recommend using traditional flossing because the combination of brushing and flossing still remains superior to any other alternative methods for those with healthy gums. But Stim-u-dents still offer a safer alternative to regular toothpicks for everybody, especially when we need to remove food particles stuck between teeth outside our private places. Regular toothpicks are thicker and more rigid, which increases the risk of creating gaps between teeth and damaging tissues.
Thank you!